A lot of attention has been placed on what we can do in terms of vaginal rejuvenation. A lot of headlines, a lot of TV stories, magazine stuff. What we haven't talked a lot about is the impact that vaginal rejuvenation can have on female orgasms. First of all, the question is, can it change? Can it affect an orgasm?
Definitely. I think whether it's a surgical or non-surgical treatment, you can definitely affect orgasms. I mean, just the fact that you're undergoing female rejuvenation, your confidence is better, so you're going to feel better, you're going to be having more sex, right? And it definitely helps if you're bringing in blood supply, whether you're having contact from surgical procedures to tighten the back up and make things a little smaller, or whether you're doing Thermiva or Genevieve or these other treatments that apply heat, increase blood supply, neuropeptides, and have better orgasm for sure.
So I guess part of the issue is the type of rejuvenation we're talking about. I mean, all rejuvenations aren't created equal, correct?
Right. Although a lot of people come to you and they're considering labiaplasty because maybe they don't like the appearance of their labia. It's too big and bulgy in the clothes, or maybe they feel embarrassed in intimate situations. You can have enhanced sexual pleasure if you have your labia adjusted, or sometimes the clitoris needs to be reduced. So there are things that you can do to enhance your sexual satisfaction and the ability to have orgasms.
Now we see people asking about the O shot to enhance orgasm. There's no real clinical data that this works, but it's a big hype about it. There's people that are very interested in that, kind of increasing the contact of that G-spot with your partner down a little bit further so you can have more stimulation, and some people love it. They have more orgasms that way.
How long does it take in terms of post-op recovery until you can, one, start having sex, and two, really enjoying it?
I guess it depends what procedure is getting done. If you're doing some of the non-invasive modalities, usually that night you can have sex. You might not notice really the benefits for a couple weeks from the non-invasive ones. If it's something like a vaginoplasty where you're actually having suturing of the muscles together, usually that's about 6 weeks. With a regular labiaplasty, I restrict also about 5 to 6 weeks for sexual intercourse, especially if you use a technique like a wedge resection. If it's just an edge trim, a very small amount removed, usually let them have sex a little earlier.
You know, the interesting thing is I've had patients tell me after abdominoplasty that they have enhanced sexual satisfaction.
Orgasms?
Yep.
Really?
Because there's some ptosis that happens of where some hanging, in the pubic area, and so once that's lifted, it's better.
You can reposition the clitoris a little bit more, and definitely have heard that.
If you'd like any more information about orgasms or anything else, come to theplasticsurgerychannel.com.